Respiratory questions 4. 24. A nurse is caring for a client with a tracheostomy tube attached to a ventilator. The high pressure alarm sounds on the ventilator. The nurse plans to 1. Assess for a disconnection. 2. Evaluate the cuff for leak. 3. Notify the respiratory therapist. 4. Suction secretion from the client. The correct answer is 4. Suction secretion from the client. 25. A client who experiences frequent upper respiratory infection asks the nurse why food does not seem to have any taste during illness. In formulating a response, the nurse understands that this is due to which of the following? 1. Anorexia triggered by the infection organism. 2. Blocked nasal passage that impair the sense of smell. 3. Lack of clean energy cook wholesome meals. 4. Infection that blocks sensation from the taste buds of the tongue. The correct answer is 2. Blocked nasal passage that impair the sense of the smell. 26. A nurse in the respiratory care unit is reviewing the laboratory results of a client reviewing theophylline by intravenous infusion. The nurse determines that the therapeutic medication levels is achieved if which of the following is noted. 1. 5 mca ml. 2. 9 mca per ml. 3. 15 mcg per ml. 4. 25 mcg per ml. The correct answer is 3. 15 mcg per ml. 27. A nurse is caring for a client with a chest tube drainage system. The nurse notes a fluctuating water level on inspiration and expiration in the submerged tube in the water seal chamber of the chest tube system. Which nursing action is most appropriate? 1. Document the findings. 2. Encourage coughing and deep breathing. 3. Suction secretion from the client. 4. Increase the suction. The correct answer is 1. Document the findings. 28. The nurse reads the client's Montag skin test as positive and notes that previous tests were negative. The client becomes upset and asks the nurse what this means. The nurse response is based on the understanding that the client has 1. No evidence of tuberculosis. 2. Systemic tuberculosis. 3. Pulmonary tuberculosis. 4. Exposure of tuberculosis. The correct answer is 4. Exposure of tuberculosis. 29. A client who is intubated and receiving mechanical ventilation has a nursing diagnosis of risk for infection. The nurse would avoid doing which of the following in the care of this client? 1. Monitor the client's temperature. 2. Monitor sputum characteristic and amounts. 3. Use the closed system method of suctioning. 4. Drain water from the ventilator tubing into the humidifier bottle. The correct answer is 4. Drain water from the ventilator tubing into the humidifier bottle. 30. A registered nurse who is orienting with new nursing graduate to the emergency room instructs the new graduate to monitor for one side chest movement on the client's right side while a client is being intubated by the physician. The new graduate determines that this instruction is based on the understanding that the endotracheal tube could ever the 1. Right main stem bronchus if inserted too far. 2. Left main stem bronchus if inserted too far. 3. Right main stem bronchus if not inserted far enough. 4. Left main stem bronchus if not inserted far enough. The correct answer is 1. Right main stem bronchus if inserted too far.